I feel kind of fortunate. When I got done with college, I had no idea what I wanted to do, and my grades were good enough to get into medical school, so I thought, give that a try. And kind of in retrospect, it's been a great fit. You know, now I know enough about myself that I like to solve problems, and that's what I really enjoy. And this allows me to do that in probably the most meaningful way I can imagine. And so, kind of stumbled into medicine, but it's been, you know, probably the best thing that's ever happened to me. You know, I think it's just being able to help people, and, you know, at least in Kansas, people are very, very appreciative. And, you know, it's always still kind of, especially around the holidays, patients come in who, you know, are, you know, just go way beyond what I would have ever imagined as far as, you know, doing nice things for our staff and our office. And, you know, so I think, you know, when you see people out in town, you know, I think if you're not listening to the patients, then, you know, your own biases kind of work into the problem solving when they probably shouldn't. And, you know, you make assumptions that aren't probably accurate. And, you know, I think, you know, 90% of coming up with an answer is listening to somebody, and probably 10% of it's actually doing an exam and finding clues that way. But, you know, I think knowing how to listen, knowing hopefully how to ask the right questions, and hopefully create a situation where a patient feels safe to talk about things openly. Yeah, I think, you know, the first time you make a correct diagnosis and, you know, put them on something that makes them feel better, then they, you know, you have an established record there that, okay, you know, this guy might know what he's talking about, and maybe I will believe him, a little less skeptical when he makes a recommendation that maybe seems a little bit out of their comfort zone. I like to exercise. I like to do yard work and garden. Like to read. That pretty much, I live in an old house, so I do a lot of home restoration stuff, and so that pretty much takes up all my free time.